Dr. Ashish Chalwade, orthopedic surgeon practicing in Latur. Today we are talking about the importance of musculoskeletal health and various problems regarding the musculoskeletal health. Musculoskeletal health plays a key role to keep up the good mobility and dexterity of the individual. Actively participation is required in our life, in day-to-day life. So it's the most important thing. Musculoskeletal health should be good to actively participate in all aspects of the life. So impaired musculoskeletal health can lead to substantial personal, community, and societal consequences, particularly in the older people. Most importantly, the impaired musculoskeletal health causing reduced physical capability like grip strength, walking, chair rising, standing, has been frequently linked to increased mortality. Thus, the musculoskeletal health is the key component of fatality. The impact of impaired musculoskeletal health is now recognized globally with an increase in morbidity and mortality related to it. While developing countries see musculoskeletal condition to have a major impact on livelihood and reduced musculoskeletal health result in a reduced productivity and economic loss to the society at all the levels. The rapid growth of these video games, social media, movie streaming, binge walking seems to be a prime contributor to our sedentary lifestyles. This surge in a second sedentary behavior is not only the major risk factor for any chronic diseases, but also recognized as a substantial global economic burden also. A recent meta-analysis utilizing the data of more than 1 million individuals concluded that 1 hour of moderate level of activity daily can eliminate the increased risk of death associated with 8 hours of sitting. Thus, a moderate level of physical activity remains a key requirement for healthy aging and maintaining the musculoskeletal health. Sedentary behavior is a major contributor to obesity and type 2 diabetes. Likewise, the diabetes is a major contributor to the development and progression of the osteoarthritis as well, with several epidemiological studies confirming that the link between adipocity and joint degeneration. Nearly 2 hours a week of moderate physical activity or about 20 minutes a day of any kind of physical activity like brisk walking, normal walking is recommended by WHO also to maintain your musculoskeletal health in good states. Furthermore, the exercise and mechanical loading also have a positive impact at a molecular, cellular, and tissue level. Like with aging, a potential for cell proliferation and number of stem progenitors like cells decrease in tendons. Exercise as well as loading can induce an increase in a tendon collagen synthesis, thus increasing tendon strength. Physical exercise and mechanical loading also have a positive role in maintaining the cartilage and bone health. A surge in a sedentary behavior and unhealthy diet have caused a global obesity epidemic, along with a sharp rise in incidence of type 2 diabetes. These are the further great risk factors for cardiovascular as well as neurodegenerative disorders, which further complicates the management of musculoskeletal disease. Obesity is an important comorbidity of any musculoskeletal condition and is also closely related to development of osteoarthritis and the commonest musculoskeletal health issues. Thus, strategies aimed at reducing obesity in adults and reduce the occurrence of OA and thus can elevate some of the pain of the condition. Obesity is also one of the most modifiable risk factors for osteoarthritis also. Exercise and weight loss have benefited overweight, obese adult and knee osteoarthritis in many clinical trials. Thus, combining modest weight loss and moderate exercise can provide the best overall improvement in systems of pain and joint function. Lack of physical exercise in childhood also causes childhood obesity, which further leads to musculoskeletal pain in later life. Furthermore, the consumption of unhealthy diet and sedentary lifestyle is contributing to the increased incidence of childhood obesity. Low in a nutritional value, high in a caloric content food further contributes to the obesity epidemic. which may also play a role in a high prevalence of type 2 diabetes and cardiovascular disease, which are the further exacerbated by a lack of fitness and inactivity. Diet is inevitably an important part of healthy living. 3-year follow-up study, including about 400 adults, that diets high in potassium from fruit like and vegetable intake reduce the amount of muscle loss more than 65 years of age patient age group. Dietary flavonoid intake like fruits, vegetables is also known as a positively correlated with a good bone health, that is the bone mineral density and bone resorption in perimenopausal women. Improving the diet of osteoarthritic patients have also shown great benefits. Vitamin D, calcium, particularly protein consumption, have been shown to optimize muscle, bone, and functional outcome in older peoples, reducing fall fractures. Calcium and protein synergistically optimize bone health. Thus, dietary strategies for improving musculoskeletal health should include consumption of long chain fatty acid, vitamin D, vitamin K, and decreasing blood cholesterol. And antioxidants rich diet may benefit athletes by improving tissue repairs. Sarcopenia in elderly people can be benefited by combining exercise with dietary supplement of whey proteins, fortified, and vitamin D, as it increases the muscle mass and the strength. So, importantly, musculoskeletal health is very important for day to day's active lifestyle. So, mainly moving is living, actually. And these all are the studies also shows that in non-communicable diseases like osteoarthritis, degenerative diseases, lumbar spondylosis, cervical spondylosis, all the diseases are very well restricted or very well avoidable with this musculoskeletal health system. So the daily exercise, dietary involvement is very important in day-to-day life to maintain our musculoskeletal health. Thanks.